Well, the United Kingdom is forging ahead with its rollout of the Oxford AstraZeneca vaccine. That despite 13 European countries now pressing the pause button on their programmes, saying they have safety concerns. About 17 million people across Europe have received a dose of the vaccine, with fewer than 40 cases of blood clots reported. I'm joined now by Dr. Veer Pushpak Gupta, who's a frontline doctor in the UK's National Health Service. Doctor, good evening. Well, good morning to you. What concern is there in the UK over the AstraZeneca jab, if any?
Well, good morning to you, Lorna. Yes, so a lot has been said about the AstraZeneca vaccine in the last few days all around the world. As you said, so many countries had banned it. But let's look at the facts. So how did all of this start? A few isolated cases were reported in Norway, in Denmark, and in Ireland over the last few weeks of having blood clots, generally in the younger population that received the vaccine. However, no specifics were given by either of those countries as to what exactly they saw and what exactly the risk was. The WHO and the European Medical Agency sat down all day yesterday and day before to discuss all the reports that they've been getting. And as you said earlier in the show, that 40 cases out of 17 million people were seen of the people that got the AstraZeneca vaccine. That puts a risk at 0.0002%. In contrast, the general risk of getting a blood clot for, say, me and you in the general population is 1 in 1,000, which is 0.01%. So if you can see the comparison between the numbers, the vaccine actually prevents you from or decreases your risk of getting the blood clot. And another thing I would like to actually mention about this is that coronavirus has now become more of a thromboembolic disease, and there's a lot of thrombosis to get COVID would actually increase your risk of getting blood clots. So to get the vaccine would be more helpful than not getting it in that case.
Very interesting. And it is just a pause at the moment that these European countries have taken. So would you anticipate that actually things will go back on track for the other European countries as well? And Australia is continuing with its programme.
Well, I genuinely hope so, because if you look at the countries that have actually paused it, Germany, France, Ireland, all of them are having increased cases every day. They're in full lockdowns, especially in Ireland. And, the vaccine is something that can help. We saw it in the UK. Numbers have come down drastically in the last 2 months. Once we were having 50,000 cases around December, where now we're only having about 5,000 cases a day. Of course, the lockdown has helped, but the vaccine has been the major factor in preventing spread of infection. So I hope that after the EMA and WHO, other countries will start to notice the results of the vaccine.
It has been a mammoth operation from the NHS to get so many million people vaccinated in such a short space of time. Is it taking its toll? Is it going okay?
It's going much better than I expected. All of us are very, very proud of all the NHS workers, including the nurses, frontline staff that are, using every available space in the United Kingdom to try and give out vaccines. I mean, conference centers, places of worship, football grounds, rugby grounds, everything is being used. And I think it's going really well. And hopefully May 17th, we should see the UK coming out of lockdown.
Yeah, and I speak to friends and family there. They're very much looking forward to May the 17th. Are you concerned, as we've seen in Italy? I'm sure you're following what's been happening in Italy. They're going into another lockdown. They've seen a third spike in coronavirus cases. Are you concerned about coming out of the lockdown, which has been so strict?
Well, if all goes according to plan, I think we should have vaccinated most of the vulnerable population by then. Of course, there are concerns. Every medical professional should be concerned because social distancing, mask wearing, hand hygiene, all of that stuff still needs to go on. We don't know how many variants will come out in the future, and we don't know how the disease can progress in terms of its infectability and spread. So we have to be cautious. But I think if the vaccination program continues the way it is and people believe in the vaccine, I think we can come out of this sooner than we think.
I don't know if you're following what's going on in Australia. I know you had the Pfizer vaccine, is that right?
That's correct, yes.
Yeah, and so the AstraZeneca as well. They are the only two that Australia is going to have on offer. But is there more in the UK?
Well, the deals have been done. Moderna, Johnson & Johnson, all of them have had deals done with the United Kingdom government. But so far on the ground, all we have seen is Pfizer and AstraZeneca. And those two seem to be doing the job for us at the moment.
Are you now really optimistic that there's light at the end of the tunnel for the UK and therefore, because the UK has been hit so badly, therefore the rest of the world as well?
I think so, Lorna. I mean, we've been at this for now 13 months and seeing the different waves, going through what we went through in December and in November, where the cases were just rising with no end in sight. I think that it's a relief to see that the numbers are coming down. But I think that we have to be cautious. As you said, the lockdown has really helped. The vaccination program is helping, but we cannot put the foot off the gas. So we need to keep going and push it through.
Dr. Veer Pushpak Gupta, thank you.
Thank you very much.